Kaveh Safavi. It's really a great pleasure to have Kaveh here with us. He's the global manager for the healthcare in Accenture, a global firm. Kaveh, I have this feel. I already tell this once in a previous forum that sometimes I realize that governments are like blind people that are trying to go without their Labrador dog, and the consultant firms like yours are like the Labradors that every government should be using before making decisions. Like, for instance, we have now the apps that are going to be a waste of time because it was created an app that wanted to be mandatory. This is just not the case of Portugal, because there's lots of distrust, as we already saw this morning in the opening panel, with Suzanne Gaunt and Charles Alesi from IMSS and other chief medical officers from different parts of the world, including your country. There's distrust in data. And definitely, do you think that a consultancy company could help government save lots of troubles? I mean, probably you're going to agree with that, but can you comment on success stories that you could have on that?
Well, first of all, thank you, Paul. It's the first time I've ever been called the dog as a compliment, so I really appreciate that.
A Labrador.
Yeah, Labrador. Oh, smart dog. I like that. Yeah. So I think I'll maybe answer the question slightly differently, because the issue is less about the kind of work we do, but what happens in a global well, I would say this: a pandemic in a digital age is something we've never seen before. And the convergence of those two is creating a very interesting challenge for any organization, because it's not possible for them to solve the problems that exist within the institutional knowledge that they have. This pandemic has forced on every dimension a level of cooperation and interaction that requires people to relate to, know, understand what's going on outside of them. And so organizations that have the benefit of sharing information and experiences tend to be able to do well in these kinds of situations, largely because we're connective tissue between a bunch of different types of organizations. I'd like to actually, though, make a comment on what the presentations were, because I think they were really excellent in terms of this idea about how, and Professor Gupta made the point about the amplification effect of COVID on digital technology. I mean, technologies all pre-existed. Obviously, pandemic is something as society we've dealt with, but nothing like this scale for the last 100 years. A combination of those two is quite interesting. What we heard here was the data being used for scientific discovery. The clock speed of scientific discovery is unprecedented. But we also, data was critical for the society's ability to meet the surge capacity needs, because the demand and the supply of services and people to meet the pandemic were not in sync at all. And so the ability to understand and match supply and demand and move resources became something that both digital technology and the data itself were critical for. What we're seeing now is in the world of mitigation and contact tracing. The ability to do contact tracing is highly dependent on sets of information and the sharing of information across parties that we really couldn't do as well, in theory, put the political issue aside for a second, without the kinds of data. And then the last one is the economic resiliency, because the consequences of this pandemic are as great economically as they have ever been, because of the fact that people could move around, and our economic production is based on mobility and global mobility. And so you stop that, and the alternative is for people to find and cooperate, share work and cooperate without physically being present. And that becomes highly dependent on data moving back and forth. So what we have seen really is the ability to respond to the pandemic is essentially completely dependent on our ability to generate and share data. And without it, it would have been a much more tragic situation, both in terms of death and economic consequences.
Definitely. Yes, so let's open up now the panel for conversation. I hope that we can flow on what we had on this, and because health data and COVID-19 is definitely probably making such an impact that the health services after COVID will never be the same, right? Maybe anyone likes to comment?
Well, I think I think that the clock speed of innovation, scientific discovery, which we heard starting with what Pedro talked about, is really unprecedented, and it sets a bar for scientific discovery and innovation that we will benefit from greatly in society. What's interesting, though, is that the real benefit isn't going to just be the discovery. It's actually going to require us to adopt these advances. I mean, truthfully, society won't benefit until the vaccines and the therapeutics are actually disseminated and used. And that's a different step. And that has its own sets of issues, some of which require cooperation, data, et cetera. So I think as a society, for us to fully benefit from the speed of innovation around the scientific discovery side will be to figure out how to drive the adoption side as well.
Definitely. And speaking on adoption, Professor Gupta, you had a success story with your app on India, right? How was that process developed?
So, this is something that we realized early on, that in a large country like India, imposing people to have practicing physical distancing, and following the norms is going to be tough. We have to be realistic that we are a lower middle income country. And we also, on the other side, have technology proliferation. If you look at the number of mobile connections, the broadband users, the best part was, let's try out something like this. And contact tracing, I think, like Kaveh said, Kaveh has worked in India to the best of my knowledge. If I can recollect, I was in Reliance, he had joined Reliance, if I'm not wrong. But what we realized, that India, the usage of data is pretty high, even if you look at from a global perspective. So we decided to use that, and our Prime Minister has a very good, equity among people in terms of following what he says. So he made a personal call to people, start using Arogya Setu. And I'll tell you what I have personally seen. In my building, we have 52 flats. I got an alert saying there is someone who has come in who seems to be a potential carrier of COVID. We checked with the security and we figured out it was a cable man who had come. So we have seen the practical application of how technology can save you. But let me give you the other side, Paul. I think this is a very good forum that, you have, curated, and it would be wrong if I didn't touch that point. On one side, we have technological maturity. We have technical solution for everything that the world needs. Any challenge you give, I and Kaveh and others, Pedro, will give you 10 solutions which are ready. But the challenge is the organizational maturity. The organizations are not ready. The people are not ready. I think what we need is a global debate with global forums, like yours, the World Trade Organization, the World Health Organization, and UN, to instill people a trust in technology, that it comes. And, the other thing that we'll need to do is to disseminate the idea of data as a global good. Because I think that's a serious challenge. Today, people are questioning, despite this 140 million downloads and saved thousands of lives, still people are questioning who developed the app. The question is not of who developed the app. The question is it useful? I think we need to create trust in technology. We need to come with evidence. COVID has, I think, as Kaveh has said, fast-tracked the adoption. When last year I started writing a book on digital health, I wanted this adoption to go ahead. I worked on every particular forum in the world. When COVID came, I didn't have to do that. I had to just complete the book. That's it. Because the evidence is mounting. I mean, you and I can't live without using technology. So I think we have to look at both sides. Once you have got the governments, which will push for it, then you have the providers, and then you have the users. My challenge is the users. I have no challenge with the first two. So I think that gap needs to be bridged.
Definitely. Okay, and now about science and research. Patrícia and Pedro, what are you experiencing from this situation that can leverage the contribution you could do to society?
Maybe I can start, Pedro. From the science side, I think that the most striking or the most positive side was that we faced we had a very fast reply, and we saw people that never thought of working together, coming together very fast in order to reach a specific goal. I work in health research and innovation for a few years, and unfortunately we still face, but it's general, it's not only in Portugal, some difficulties in putting academics working together with clinicians, with the data scientists and molecular biologists, and so on and so forth. So I would say that if there is a positive side for science from COVID, was the fact that it showed us that we can work together fast for a common goal. We saw that at national level, at European level, which is the ones I follow most. New teams came together, people that had never met together, sectors that were not working together, facing a common goal. So I think this is a great lesson for us in terms of health, more practically, more health systems and implementation. I think this was discussed somewhere else, but we faced advances in a couple of weeks that we would wait years for them to happen. So let's also take the best out of that. But for science research, everybody came together in a few days, I would say, a common goal, putting efforts together, industry, academia, all sectors together. And this is something that we have to preserve for the future.
Yeah, I'll more or less follow the same lines. I think, we've been doing this now for a few months. It's quite intense, and I don't think it could be easily reproduced in another setting. And I don't think it could also not last at this pace for another year. People are just exhausted at this point. But it's interesting to know that I think it would not be possible to coordinate this better from a top-down perspective. I think that's a good lesson to learn. I think if, say, Europe and the US and other countries would decide to say, this is how research should be done, I don't think it could have been coordinated better, even though there's some wasted resources and some duplicated efforts. I think the scientific community has done as best as I think could have been done in the short span of time. There is, this connection to the human genetics and to the health records. It's still not possible to do at the scale that would be not ideally done, because there are many countries that simply just don't have this set up. The North in Europe.
Could India be an ideal lab for that?
To set up the health records and the genetics? I don't know about that in India. I know in Europe, even in Europe, I guess the Nordic countries and the UK have this well set up in terms of health records and human genetics, but even the rest of Europe has not done this well. Germany has lagged behind, and the US, because of the perspective coming mostly from the industry, it has its own issues, I think, as well, in terms of being able to do this properly. So I think that's one aspect that was not, I think, still done as easily as it could be, and also the translation to clinical trials, which in this case was particularly difficult. You wanted to rush as quickly as possible, maybe jumping over some typical model systems that one would use before going to human. And that's also an aspect that still, this transition is still not easy by any means, but it shouldn't be easy because, it's quite important that it's safe. But maybe there should be still better ways of doing that.
Definitely. Thank you so much, Pedro. Kaveh and Professor Gupta, any comments?
I do. Well, first of all, I agree with Pedro's point that I think that the scientific discovery is unprecedented, and it required global cooperation. And the urgency, the global criticality of it was what was driving. But at the end of the day, if you think about it, data is a double-edged sword, because it gives us the ability to know. And the ability to know gives us the ability to create benefit. But it also is a significant issue around our notions of privacy and sovereignty. And this is what Rajendra was actually, I think, touching on. The challenge is that at an individual level, and you see this playing itself out in live time around issues like contact tracing, right? Is as a society, public health has always wanted to know who has a disease in the interest of the public. And there's always been this challenge of the individual feeling stigmatized about whether or not anyone knows that they have the disease, and the public's desire to know in order to mitigate the disease. Now that we can collect that information passively, that just makes the situation worse. It doesn't make it better. It doesn't help the individual who's fearful of stigma. A live example in the city that I live, something as simple as the ability to tell first responders, if they were a fire or ambulance, if the police, if they're arriving at a home, that there's a COVID positive person in that house. The legislature basically created an ordinance that said that they need to know. And the executive for that geography reversed the position and said no. Why? Because they were afraid that they wouldn't get any responses if the fire or the police knew. And technology just made the ability to know that passive, which made the problem even worse. But it was a political and a social problem. And we see the same issue going on right now around agency. Healthcare is fascinating because at the one level, we as humans, our biologies are the same. It knows no national boundaries. But every country considers the health of its population to be a sovereign asset. And so while it makes complete sense for us to try to understand the body and discover treatments in a global way, or to care for each other in a global way, the notion of sovereignty, that we belong inside of a boundary and therefore that information can't travel, that didn't get solved by data. The problem just got worse with data, because now we have more dimensions that we have to address, not just my physical presence, but my digital presence has to be managed. So I think we are having an interesting challenge in that these fundamental social or these fundamental political and policy issues haven't been addressed, and we've just made the problem even more complicated by adding more dimensions.
Yes, it's interesting because it's so true. Professor Gupta, any comments on this?
Yes, on the collaboration side, I'll just talk about the practical examples. So there is a COVID vaccine trial going in Oxford in the UK, and India is the largest producer of the vaccines in the world. Serum Institute produces 70% of the world's vaccines. So just imagine that COVID has only connected those dots of research, trials, and the production, and then it will eventually land in the supply chain. So I think the world gets more connected thanks to COVID, though not the right thing, but politically we are more divided than ever before. So I think it is required that science and politics, which never walk together, will find a middle path. If they don't, we always aggravate a problem, because as I think Kaveh said, that the district executive reversed the orders. Let's follow science, as simple as that. And science would help solve our problems. But the only question is, working with politicians, how do we make them understand political science and science are different? That's the challenge. We hope forums like this, if you get more policymakers, eventually we'll arrive at a middle path. That's what I hope, optimistically.
Definitely. So we are approaching 10 minutes before the hour, and probably there are some questions here on the participants in the audience. If there's participants in the audience that I would like to place a question, it's your moment. We are a global summit, so we would like to have participants also to voice their questions and their any comments that they would like to add to the debate. If not, then I will try to make it the last round and close the session. So no participants on live now. It's your last chance. 1, 2, 3. Okay, so last round of final comments. So we have here an interesting set of presentations that were offered in the start of this presentation. We also had an interesting discussion within both the perspective of the technology, policy making, and science and research. In the end, the conclusion is that definitely politicians and science need to be together. And that's the conundrum we need to solve, because obviously we all understand that politicians require protagonism, that then science will tell in everything they need to do, then the politician would not be at all pleased with that situation. But anyway, a final round of conclusion of observations, and I will start for the order of the presentations. Pedro, Professor Gupta, Rajan, maybe Kaveh, you could close as you didn't have the presentation, and you are the consultant, so you probably give us some advice in the last round of comments to us all. Okay, so Pedro, Patrícia, Pedro, Professor Gupta, Patrícia, and then final round for Kaveh. Last observations, and we'll close the session. Pedro.
Yeah, so I guess 2 points. One, as somebody who works with data very often, and I still see, in many different countries around Europe, but also around the world, there's still the capacities, both in the health sector and still research, and definitely the political side, of being able to understand how data needs to be used and sort of implementing in practice things still lags behind it. That it still goes to fundamental education still. So in the education system in many countries, people are still not being put through in the educational systems with the knowledge to be able to do these things. And I think that's something that still needs to be addressed. or a more optimistic and positive take out of this, I think, I would definitely say that both the science community and the medical community should be put on a pedestal. I think they've done amazingly well throughout this COVID crisis. It's still not the time yet to look back, but I think we're going to look back and be very proud of how the health sector and scientific sectors have responded so well.
Fantastic. Thank you, Pedro. Thank you so much, Professor Gupta.
Yeah, Paul. The part that we all have faced through COVID in the last 7-8 months is that we have seen close family, friends, and colleagues being affected by COVID. Some having lost lives. There's a whole lot of seriousness around it. This is the time to put the momentum into action rather than losing it. I think as humanity, we have this trait of forgetting and pushing it behind us after a while. So I think what we need to do is move fast and define the global governance, ethics, and regulations with regard to data. That's the key. I'm going to talk about it tomorrow in my session.
Thank you.
And the second thing which is important is capacity building. We do not have the likes of Pedro's in every country, and imagine we are 7.8 billion. We do not have people like Patrícia or Kaveh. We need to have capacity building given what we face today. You cannot be managing millions of people, with few concentrated in places. I think we need to have that leadership qualities, understanding the entire ecosystem. So whereas it appears complicated, but if we disseminate the message pretty well with action points, I think we should be able to be better prepared should something like this strike again. And there is no guarantee it will not strike. Thank you.
Thank you. Thank you so much. Patrícia?
And a follow-up of what my speaker colleagues have been saying, I think that this is an opportunity and we have to take the best out of it. I think that transformation of health and care systems globally, it's a very complex endeavor and that it needs to be addressed from many angles simultaneously. But this is a good opportunity for us to take this endeavor, and the success will depend on the ability of the decision makers to learn from each other, to look across national and regional borders and also across different sectors and learn from this and take stock of everything that has been done so far, so that we can really use this period and ensure the transition towards a more sustainable, resilient, innovative, and high quality and people-centered health and care systems globally.
Thank you so much, Patrícia. Thank you so much. Kaveh, last but not least, closing comments.
So I think this pandemic has proven to us how critical and dependent our society is on digital technology and data, and that we simply can't survive both from a physical and an economic perspective anymore without a base. However, even before COVID, we began to recognize that digital technologies and all of the issues that sit around the data conversation are fundamentally being limited by the ability to address some of these policy issues that we described. In fact, our global survey on digital health adoption showed that the adoption rate of digital health technologies has actually flattened out over the last 2 years. Because of personal privacy, individuals' concern about who has their data, because the digital experiences didn't work, because the delivery system didn't recommend it, even though the consumers were using it, all kinds of reasons. All this says is that if we don't address not just the issue of are things possible, but are they permissible, we're not really going to benefit gain as a society the full benefit of the technologies that we have evolved. And I think it's incumbent on both sides of the equation. So for those on the technology side who are building, to recognize that simply building it isn't enough. And then for those that are on the delivery system or the consuming side, to recognize that there are a set of answers that are simply not possible without availing themselves of these capabilities that exist. Both sides are going to have to work to bridge that gap. It's not going to be one side or the other.
Guest speakers for your presence here. I just would like to remind you that in the afternoon we are going to have interesting keynotes from WHO David Novillo Ortiz, which is responsible of health data, and is going to talk at 2 o'clock here, along with Las Montelius from the INL, our research and development global partners in the Health Data Forum. We are very proud to have INL, International Nanotechnology Laboratory, as a partner. And definitely, Patrícia, this is not a pitch, but from what I see from the AICIB, there's definitely a lot of synergies with the Health Data Forum and AICIB that we could construct together, because there's going to be a lot of work to do on data and healthcare. So thank you so much for joining here today for this session. Let's go and have a lunch break on this side of the world. And Kaveh, a start of the day for you. And Professor Gupta, a good evening for you, right?
Thank you. Thank you.
Thank you so much.
Thank you all.
Thank you.
Thank you. Goodbye.
Bye.